Hello, everyone. Today we'll be talking about e-health. Everyone is talking about e-health nowadays. So I thought, why not to cover a topic on this? And I'll be covering about telenursing in the e-health, but I'll also be briefly describing about the telemedicine. So telehealth is a technology-based virtual platform to deliver the various aspects of health information, prevention, monitoring, and medical care. Telehealth is a broader aspect we use nowadays where we have different subtopics also or sub areas also. Like the telehealth can have telemonitoring, telenursing, tele-allied care. They can be telemedicine, teleconsultation, telediagnosis, teletreatment, teleeducation, teleadministration, and telebusiness. So, first of all, we'll cover about the telehealth. Broadly, when we talk about nursing, we usually use the words telemedicine and the telenursing. They are used interchangeably, but there is a thin line of difference between both of them. So, when we talk about the telemedicine, it is the remote delivery of healthcare services over the telecommunications infrastructure. Okay, इसमें क्या होगा जो मेडिसिन रिलेटेड ट्रीटमेंट रिलेटेड डायग्नोस्टिक रिलेटेड हेल्थ केयर सर्विसेज हैं using the telecommunication infrastructure, those services will be provided. That will be a part of your telemedicine. But when we talk about the telenursing, it is a subset of the telehealth. It is also a type of telehealth which focuses on delivery, management, and coordination of care and services using the telecommunications within the nursing domain. So, any kind of telehealth facilities where the nursing is involved will be known as telenursing. So I'll be covering about telenursing in my today's video. We can have three types of telenursing or three types of telehealth, that is synchronous, asynchronous, and the remote monitoring. Now you must be wondering now what are the meanings of each one of them. So the synchronous means that whenever it is a kind of live telecast, you can say that. So agar मान लो the patient is there in the clinical and you have the tele nursing setup there, the patient can be easily viewed by the nurse, the expert, the clinical nurse specialist who is sitting somewhere else in the other clinic, other hospital, and then they can monitor and they can examine and they can assess the condition of that patient who is not sitting along with the healthcare worker, but who is sitting in a remote setting. And उस हिसाब से whatever is the management, they'll be planning it साइमल्टेनियसली. तो क्या हो रहा है कि आपके पास जो हेल्थ केयर वर्कर है वो अपने क्लिनिक में है या अपने होम एनवायरमेंट में है, अपने हॉस्पिटल में है, और जो पेशेंट है वो कहीं दूसरी सेटिंग में है, मे बी इन अ विलेज और इन अदर सेटिंग्स, बट थ्रू दी मोडालिटीज और थ्रू दी टेली मेडिसिन फैसिलिटीज दे आर कनेक्टेड विद ईच अदर, एंड देन द हेल्थ केयर वर्कर इज एबल टू असेस कि उसको क्या प्रॉब्लम है. ओके, द पेशेंट सीम्स टू हैव ascites, the patient seems to have shortness of breathing, the person seems to have so and so problem, and then the instructions, treatment, and the management will be done remotely by the healthcare worker. Yes, there will be the assistance available, right? जहां पे आपके पास विलेज में या उस क्लिनिक में जहां पे पेशेंट है वहां पे आपके पास कोई हेल्थ केयर वर्कर होगा जो उसकी कंडीशन को हेल्थ केयर जो दूसरा हेल्थ केयर वर्कर है हु इज एक्सपर्ट पर्सन उसको बताएगा, बट देन the decision can be taken by the person who is expert in that, right? That is a kind of synchronous, simultaneously साथ साथ में दोनों चीजें हो रही हैं. The next one is asynchronous, जिसमें क्या है साथ साथ में चीजें नहीं हो रही हैं, या like what we are doing, we have recorded this session, isn't it? And you are listening this session maybe after 2 years or maybe after 2 days or after 2 months, right? But the information what you'll be getting from this session, you'll be able to apply that. That is a kind of asynchronous, है ना? आप देख रहे होगे the methods of physical examination or the different kind of diagnostic modalities, different kinds of treatment approaches. You can just refer some kind of video, some kind of the material which has been given to you, and then you can use them in your day-to-day clinical practice. So ये क्या है? ये simultaneously नहीं चल रहा है. It is a kind of asynchronous telehealth approach. And then you have the remote monitoring, which is also known as RPM, which is your remote patient monitoring. इसमें क्या होगा? That okay, the patient is a COPD patient. The patient has shortness of breath. The person has difficulty in breathing. It means so the patient needs to be monitored for the SpO2, right? So इसमें क्या होगा? The patient will be advised to have the probe connected, and then what you can do, you can have the record in of the patient's SpO2, maybe 24 hours का कितना data है उसका, 1 week का कितना data है. The healthcare worker can see that on their screen. So this kind of sensors are available. Or the patient is a patient who has different kinds of arrhythmias, right? उसको बीच-बीच में arrhythmias होती हैं, but when the patient is in the clinic, that time when you had the ECG, the patient was not found to have that arrhythmia. So आप क्या कर सकते हो? Nowadays the technology is available in such a way that the patient will be wearing those electrodes, and remotely when the doctors, cardiologists are sitting somewhere else, they can have the data of the patient's electrical conduction system of the heart also. So they'll be able to assess the patient remotely. दूर से उनको पता चल जाएगा कि patient क्या status कैसा है, right? So that will be a kind of your remote monitoring. So your tele-nursing, telemedicine, telehealth can be of 3 types, which is synchronous, asynchronous, and the remote monitoring. Then I'll be giving you few examples of telenursing. These are taken from the researches which have been published, and the data is from there only. So I'll be showing you different research articles. Definitely, I won't be able to cover everything in detail, but yes, just to give you one glimpse of what is happening worldwide in the field of telenursing. Because इससे क्या होगा? आपको भी idea मिलेगा that how can you use such kind of services in your department, in your nursing practice, and at the same time you can also be able to plan some kind of projects using the telenursing approaches, so that we can use the digital technology in healthcare, in nursing, as far as it is possible. So we'll just show you a few examples. This was one of the scoping review where the telenursing's potential was assessed as a nursing care delivery model in the lung cancer during the COVID-19 pandemic. Yes, after COVID, everyone will be agreeing with me in this, that uh, this digitalization of telenursing, telemedicine, teleeducation, they were not that common before the pandemic era. But, as everything has something positive, COVID also had something positive. And, now we are more tech savvy. We are more open to use the like these technologies. And yes, we have also found out that the technology is very good, and telenursing, telemedicine can be really very patient friendly and can be very easily used by the healthcare workers also. Likewise, a study was done during the COVID-19 pandemic, where you know that pandemic ke time mein kya tha, the patients were not that frequently visiting the hospital. It was not very safe also to visit the hospital at that time. So what they saw that, or they did a study where it was seen that the telenursing, the nursing care delivery was done with the help of telenursing approaches, and which was very beneficial for the patients who had the lung cancer. The symptom management improved, their functional status improved, the quality of life was improved. So the telenursing can be used for those kind of patients who have the chronic cancers or chronic diseases such as lung cancer also. Same way, this was one of the study where the comparison was done between the home visits and the telenursing on the blood glucose level. Okay, they have compared whether the blood glucose level, that is HbA1c value, was brought to down or brought to normal limits using the home visits versus the telenursing, where the study found out that the patients who got telenursing services, they were seen to have a reduced HbA1c level. So it means the telenursing was effective, and this reduces or this decreases the need of visiting the home of the patients, right? So this will be troublesome also. So patient friendly bhi hoga, healthcare friendly bhi hoga, and the patient's parameters are also brought to be normal. Likewise, this was one of the scoping review where the use of telenursing was assessed on the surgical cancer patients, like how the telenursing can be used for the patients who are having the cancers and who are undergoing surgery for that. So that was explored in this study. And then one more study was done to assess the telenursing in incidents and disasters. Even in disasters you can use telenursing. So because that disaster is something which can lead to a lot of casualties and all. So telenursing can be very safely used even during the disasters. That was that was a finding of this study which was conducted. Then there was one more study, which is a higher form of research evidence, a systematic review and meta-analysis done on the effect of telenursing in the home health care, and which was also found out that for the management of chronic diseases, the telenursing is really very effective. Then one more study. I don't know whether you're getting bored watching these all articles, but I found them very interesting, isn't? The world is all talking about telenursing, and this was one study where the nurses' strategies to provide the emotional and practical support to mothers of preterm infants were assessed in the neonatal ICUs, and the effect was seen on different kind of things, such as on the family-centered care, skin-to-skin care, patient support, education programs, even the spiritual care. So it was found to be effective among those uh, the mothers who had the preterm baby in the neonatal ICUs, right? Then there was one more study which was on the effect of nurse-led telecoaching. You can use different kinds of words like telecoaching for patients with heart failure. And they found out that if the nurses are coaching patients using the tele-nursing infrastructure and resources, it is having a very positive impact on the patients who have the heart failure. It is helping them to learn about the disease, to learn about the mechanism of action of the medications, and also is improving their quality of life and the self-care behavior. So heart failure patients, telecoaching, telenursing approaches are very beneficial. Then it was one of the review which showed that the telenursing can be very well used for the patients who have the chronic illnesses. You know that nowadays chronic illnesses are on the rise. So definitely we can explore this area of telenursing where we can help our patients to have a better quality of life using this approach. Then this is the Indian, like many of them were also Indian studies, but this is one of the Indian app which is on Dhadkan app, which is an indigenous smartphone app for the heart failure patients. So the patients who have heart failure, they can download this app and they can fill their data, and it will help them to monitor their the health status. It will also be helpful for understanding about their disease progression, about what to do, what not to do, about the medication related, about their status, how it is improving or it is deteriorating. So it is one of the app which was like this has been used among the patients who have the heart failure. So that was about telenursing and telemedicine, and how with different researchers you got the idea that how can we use the telenursing approach for the betterment of the patient's quality of life. Then also there is one study which is on the teletriaging. So it has been also seen that it is not always about telenursing, telemedicine. Even you can triage the patients using this approach, So you can have a different kind of in this study, they had the screening, they had the SWOT technique, which is screening the patient via video, audio, and or the chat box. So depending on different kinds of patients, they used to screen it, which patient requires the immediate care, which where the care can be delayed a bit, and depending on which the care has been given to the patient. So even the tele triaging can be done. which will be reducing, definitely, which will be reducing the time which is wasted inside the hospital, and the patients will be getting the care as early as possible. Then even the teletriaging has been tried during the COVID time in the psychiatry department, because that in psychiatry also we need to see which all patients require the immediate treatment, or which all patients we can just delay our treatment a bit. So as with that study, this was a model given where the patients were triaged on the basis of whether they want to have a face-to-face consultation, or they can be like they can just need the telephonic consultations, or if they need to have a screening. Okay, depending on the screening, they will be segregated as those patients who will be requiring the telephonic consultation, those patients who require the in-person visit, the patients who needs the counseling immediately. So the teletriaging can also be one of the technique which can be used among the patients, even in the psychiatry departments also. Then comes the need of tele-education. Okay, what we are doing now, it is a kind of tele-education only. I'm sitting somewhere else, you people are sitting somewhere else, and with the comfort of your home environment, or with the comfort of wherever you are, you're able to learn something new. I hope you're able to learn something new. So that is a kind of tele-education only, be it a live streaming, or be it a video recording, be it a Zoom platform, be it a Google Meet platform, or Microsoft Office, or maybe the YouTube videos. So that is also a kind of tele-education. And we all will agree on this also, that these kind of practices are definitely on rise, specifically after the COVID has hit the world. So these are few examples I would like to give from my experience only, that when there was COVID, our team had this national program, or on the empowering warriors. Okay, everyone was thinking that how the COVID is going to affect them, which kind of precautions they need to take, and how they can prevent their kids, how they can prevent their families, and different kind of things. All of you will, I think, will be completely in agreement with me if I talk about it. The disease was new, किसी को कुछ नहीं पता था, मतलब जो कोई बोलता था, we used to follow that, right? So here, that time we came with this program where we talked about, we used to update every day, every time, using the ministry guidelines, and we used to update people on different kinds of things like what is COVID-19, how it spreads, how can we prevent it, which kind of precautions the healthcare workers should take, which kind of precautions we should take at home, and what is the management, what are the new technologies which can be used, all those kind of things. And the response was very, very good, because that was a need of the hour. And as it was using the tele-education approach, people used to learn that at their ease of comfort, right? So that was one of the examples. Same way, there are different projects which have been running. I'm again giving you my personal experiences only. Like, we had one project lead, where we talked about alcohol and liver, how the alcohol is affecting liver, and different kinds of sessions were taken by the experts in the field, and they talked about how can we prevent, how can we manage, and all those kind of things when we talk about alcohol and liver, or when we talk about other kind of things like hepatitis and COVID, and all those kind of things. And we saw the research, we also did the impact analysis, and we saw that there was a huge impact of these programs. People used to really learn and enjoy, and used to implement those things which were taught to them. That was really very satisfying. So that was all possible because of technology and because of tele-education. So these are few of the researches which were published because of the impact which we saw on the different education programs done using the tele approaches. So afterwards, there is one more thing I would like to talk here, that is about Ansakhi. Uh, you know that we have ASHA workers, that is your accredited social health activists, who are working village to village, taking care of the health of the mother, health of the baby, and the society as whole. So, these ASHA workers are usually taken from the local community. Not usually, it is always taken from the local communities only, and they might not be very updated. They might not be very much educated also. So the government also brought this concept of having the M-Sakhi. आजकल क्या है? Everyone has the phone. So that was using the mobile applications that the ASHA workers will be getting this application, because using that they could like I'll just show you, they could do the registration, है ना? Otherwise कितना लिखने का काम है? They have to really fill a lot of registers, books and notes and all those kind of things. So they can do the online registration, they can do the counseling assessments, they can be real-time alerts, real-time monitoring, supportive supervision by their heads and their supervisors. So it was one of the initiatives which was to help the ASHA workers in doing the activities in a better way. So that is also again a kind of your electronic health services only. Then I think everyone is aware of this Ayushman Bharat and telemedicine. It has really led to a huge impact, we are using different kinds of telemedicine approaches using the Ayushman Bharat platform, where you have the Abha integration, Ayushman Bharat Health Account integration, the multilingual interface, so that everybody can talk in a language which is comfortable to them. And then they can consult the doctors remotely, and they can avail the allopathic as well as the Ayush healthcare services. Same way, we have the e-Sanjeevani, which is also part of your Ayushman Bharat. Again, a telehealth approach only, digital health approach only, where they can be patient to doctor telemedicine consultation process or assisted telemedicine consultation process, where the person has to be registered, consultation should be booked, EOPD has to be entered, and the doctor can be consulted, specialist can be consulted online, and the e-prescription can be you can get the prescription afterwards. Same way, if you click on the assisted telemedicine consultation process, you have the community health officers. Definitely nurses are serving as CHOs in most of the places, which is really very proud moment for our fraternity, where the person will be and we are visiting the nearest health and wellness center. We'll be meeting the community health officers. The community health officers will be creating the case in the e-Sanjeevani. Then they can consult the specialist or the doctor, and they can get the e-prescription. So these are few of the methods where the e-health has been utilized. So why do we want? हमने इतना पढ़ लिया इसके बारे में that we have so many options, so many approaches, so many areas where the e-medicine or telemedicine can be used, telenursing can be used. Why do we want to use it? Definitely, it has benefits, like it can lead to improved access to healthcare, है ना? अगर आप hospital नहीं आ सकते हो, hospital आपके पास आएगा using the telemedicine approaches. You can monitor remotely. It can be cost effective because आपका आना जाना रुकना or all those kind of expenses can be taken care. It can lead to hassle-free management. It can be convenient to the patients. It can enhance the preventive care, can lead to better patient outcomes and improved continuity of care. So that is a positive side, and definitely it has a lot of benefits. Therefore, it has been used full-fledged all across the world, especially in India also. But it also comes with the challenges. Okay, हर चीज का positive है, negative भी है. So what are the challenges which can be associated with your telenursing and telemedicine? It relies on the technical devices and internet. Everybody is not tech savvy, है ना? सबको technology नहीं आती है, and the facilities of internet should also be available. So if it is not available, definitely you won't be able to use it. Then it can, when we do something and when we touch, we palpate, we assess, we inspect, isn't it? There is a concept known as therapeutic touch that is missing in such kind of services. So you won't be able to provide that therapeutic touch to your patients. You won't be able to do certain kind of investigations or examinations and assessments on the patient. It also comes with the challenges. But yes, they have their own answers. They have their own solutions also. It can have the security issues, cyber crimes, your data can be leaked, and it can really cause issues because of that. And the generational differences, we might be very open to the changes, but those people who are not that tech savvy or not that open to the changes might really suffer. Gen Z's की बात करें, even millennials की बात करें, it might be convenient for them to use. But when we talk about the older generations, yes, definitely they might not be that much comfortable to deal with the technology and all those kind of services. So these are the challenges. But yes, we should try to see how can we come across, how can we overcome these kind of challenges and can really accept something which is good for the profession also, for the world also, for the customers. In our sense, it is for the patients also, isn't it? So we have to just see how can we overcome these challenges so that we can take the full advantages, full benefits of using the technology and our patient care in the healthcare settings. So that's it for today. I just thought that I should talk about telenursing and telemedicine with all of you. And I really look forward when you can talk about how you are incorporating telenursing in your field. है ना? आप कैसे use कर रहे हो? Are you using, first of all? And if you are using, how are you using it? Are you using it in the research? Are you using it in the education? Or are you using it in the clinical practices? I really would like to know about it. So that's it for today. Thank you so much.